Ignatius is a geek. I mean, it's like here it is. After all his hard work, he gets, he leaves the California Endowment, and he has, time to himself, time to spend with his partner and his family, and to travel. What does he do? He reads the entire 2,000-page healthcare bill.
And it was very, typical Iggy. It was like not a big deal. I guess that's what I'm going to do, right? Not a big deal, but he knew it was purposeful. It wasn't, I got some spare time. It was I'm doing this because of, right? And it was always in service.
As an attorney, I learned to work with all different kinds of folks and on different kinds of issues, from straightforward immigration status issues to helping folks get access to welfare and public benefits.
And he was very impressive. He actually wrote a book. I think he was age 25, and he wrote a book about the sanctuary movement and the basis for it.
Also really began to learn about health issues and how important health services are, and oftentimes their immigration status prevented them from getting health benefits. For so long, organizations like the Health Forum, like Asian Health Services, had been advocating with the federal government for more attention, of saying, we're here, we need more resources, we need more programs that are focused and targeted for our communities.
It was actually an initial strategic plan with the Department of Health and Human Services to address Asian and Pacific Islander health. And I just have this vision of Iggy standing by my desk and saying, let's do an executive order.
And so I began researching this idea of actually elevating this whole concept of an initiative focused on Asian Americans and Pacific Islanders all the way up to the White House through an executive order.
Without the vision of those external leaders like Ignatius and Karen and Stuart and Sherry and so many others, I don't think this would have been the success that it was. Leadership matters, and Ignatius is a leader.
This was a way to say, well, there's a process in your government that identify the needs and priorities of Asian Americans and Pacific Islanders, and pay attention to that in terms of how you plan and strategize government services.
Well, I came to this country really as part of a refugee family. My mother was from China, and she met my dad in Japan. The 3 kids were born in Hong Kong. I always joke that I'm a real FOB, fresh off the boat, because my family actually came on a passenger boat. And one of my first memories is coming to Chinatown, actually, in San Francisco. And the first night that we were in San Francisco, we stayed in a hotel. And I remember riding my tricycle down Bush Street, right past the gates of Chinatown, and my mom running after me to get back onto the sidewalk and into the hotel. So I really feel like I came to the United States, came to San Francisco, and found myself right in the middle of the community in a lot of ways. My mom became one of the first bilingual Chinese teachers that the school district had hired. And so now that I do a lot of my work on language access, making sure that people who speak languages other than English have access to government-funded services and other kinds of services, I really feel like I'm honoring my mom's memory and legacy through all that work. What was happening was that there were lots of folks who were green card holders, who were permanent residents, who had gone home to Asia in particular to visit their family. And then when they returned, and they were coming in by plane, so they were at San Francisco airport, the immigration officials would question them and say, if you are getting any kind of public benefits, including health care benefits, we're going to take your green card away. So in working with Asian Health Services, who this was happening to a lot of their patients, we were able to organize both the legal arguments as well as bring the actual experiences and those stories of patients from Asian Health Services that had been stopped at the airport. We're talking about people who are legally here as permanent residents and not yet U.S. citizens who are going to be kicked out.
Ignatius Bau was the most important person within philanthropy in the last 15 years on the issue of language access.
I think largely because of Ignatius's work in giving these organizations the resources to help develop these standards even further, that we're actually seeing them come into fruition.
He crafted the strategy by which organizations from the Joint Commission that sort of oversees standards in the healthcare delivery to grassroots advocacy organizations really sort of came together and said, this is the way that healthcare ought to be delivered.
My experience, especially at an Asian Health Services member meeting, is when you give people the tools to communicate, when you provide interpreters, when you allow people to speak in their own language, they've got lots to say. They're very, very clear what it is that they need and what it is they want. A lot of times our ideas of many Asian American groups being passive or quiet or polite isn't true if you give them those tools.
Ignatius just has these skills of bringing together different social justice issues, knowing the law and policy, as well as being a strategist. It's just, he's just that complete package.
For many, many Asian Americans, we really are straddling constantly across 2 generations and 2 cultures. I go back home to my 90-year-old dad and find myself speaking Chinese. That's a real reminder to me that language is really important and culture is really important. I have that reminder every time I go home, but it definitely has influenced and shaped the choices of the type of work that I've done.
He's had a wonderful career, and he has another 30 years of wonderful career ahead of him, and he's had a very eclectic and diverse set of opportunities, but they've all been woven together by the thread of serving underserved communities.